Welcome, everyone, to the EOXS Stories on Steel podcast. So my name is Lew Dennen, and today we are honored to have with us Tom Zuccarini from Vested Metals International. Have I said all that correctly?
Yeah, that's correct. And you pronounced my last name correctly, so you're all good.
All right, so far, batting 1,000. You are the Chief Commercial Officer.
I am.
Excellent. Tom, thank you very, very much for taking some time out of your morning. I know there's lots of stuff going on in the steel world, the metals industry, and I do appreciate you taking some time and sharing with us some stories, some information. Let's dive in.
Yeah, absolutely. I'm looking forward to it, Lou, and happy to have the conversation.
Outstanding. I guess my first question is, let me ask you about kind of your journey, if you will, kind of how you got into the business, how you got into any part of the business. Please, sir, go for it.
Yeah, so I grew up in Reading, Pennsylvania, and Reading is a smaller town. They had a couple of major employers, one of which was Carpenter Technology. So as a kid growing up, I had a lot of relatives and family friends that worked for the company. So I knew about Carpenter. I went off to college. I studied business and marketing. And I graduated and I followed the marketing path. I went to the AC Nielsen company. I don't know if you remember that name, AC Nielsen. They did the TV ratings.
Oh my gosh. Yes, yeah. When I was a kid. Jeez.
Back in the day, and they had like other divisions. So I hooked up with them on the marketing side for their food and drug, market reporting system. And so I worked for them for about a year. I wasn't really crazy about the work that I was doing. And I was in El Paso, Texas, which was a big change for me. So, growing up in the Northeast. So I thought, I kind of feel like I'd like to get back to either the East or the Midwest somewhere. So I reached out to Carpenter, and they had an opening in their Cleveland service center. Okay. So I started, and this goes all the way back to, I'm going to date myself now, but 1984, started as an inside salesperson with Carpenter in Cleveland. And that was really the beginning of a long journey. I spent 38 years with Carpenter. So I had a long career with them. And I've been in specialty metals, basically my whole working life, with the exception of that 1 year with the AC Nielsen company. So got quite a bit of exposure. Yeah.
Okay. Were they also? So Carpenter was not that this is about Carpenter at all. What was their sort of main thing they did?
Yeah, so Carpenter, they were a specialty steel producer, meaning like the stainlesses, nickel-based alloys, high temps, and that's exclusively what they did. They were big in the aerospace industry. They did a fair amount of medical at the time, but they would get into other applications. Electronic, consumer, industrial. So, that's what they did. It was not the traditional high volume carbon steel that you typically think of, with, traditional steel industry. That's not what they did.
Gotcha. So in that sense, is when you went to Vested, is that kind of a very similar company in terms of what Carpenter was doing, and so it was kind of a natural move, if you will?
Yeah, so throughout my career, I held various sales and marketing positions. The markets that I was involved in initially, aerospace, industrial, consumer, and then, in the middle portion of my career, it was a lot of automotive. And then the latter portion, I had a position in the titanium producing division, which was Dynamet, and I focused almost exclusively on medical. So I spent 38 years in various positions, and then Viv Hellwig, the president of Vested Metals, approached me, and he was, as a young company, he was looking for someone with some good experience and historical perspective on the industry, someone that had knowledge of different applications and markets and relationships, and he had a young staff too, and he just felt like he was looking for someone that had those leadership credentials. And I was interested, because I had been with Carpenter for a long time, and I'm not going to work forever, so I felt like this is a really nice opportunity for me to kind of transition into something where I can use my experience and my knowledge and share it with a young company and help them on their journey, as I kind of, approach retirement. And I haven't really picked a date for retirement, but I know it's out there somewhere, right? So I'm looking to, enjoy myself for these final years, however many that is, and contribute, and as long as I'm contributing and having some fun and helping this company out, then that's really what the incentive for me was to kind of come on board. Outstanding.
I looked at the Vested Metals website, trying to just get a feel for it, and you certainly, I'm from the carbon industry, so of course we used to call the stuff you guys get into, right, exotic metals, which it's exotic to us, but not to anybody else who's in it. But obviously, one of the really interesting things that I noticed was the medical portion, and I bring that up only because on a secondary note, I saw by the way, anybody that needs to go check out the Vested Metals website, it's really cool, and there's a great section where you have a newsletter, and so I read the September 2023 newsletter, and it's absolutely, anybody should go check it out. There's a lot to learn there. It's a really cool write-up. You have a whole section on medical and and surgeries and stuff. The reason I brought that up is because many of us have had, have had the opportunity, as you want to call the opportunity, to have surgery where a metal is used of some sort. I'm wondering, people that are listening, could you explain a little bit about kind of how your company gets involved in that and kind of what the procedure looks like?
Yeah, I'd be happy to. So medical has really, transitioned over the years in terms of technology and medical device. And a big portion of that is the materials that are used in different procedures. So you have the materials that are used, which, in many cases are going to be implantable. There's going to be devices that are used for a procedure, but then that device might be, removed from the body. But a lot of these devices do stay in the body, so they have to be biocompatible. And that's where the implantable grades of stainless steel come into play, as well as titanium. And over the years, there's been a transition to titanium, because titanium is a great material for the body, because the modulus of titanium is very similar to bone. So, and then the other thing is, bone really likes titanium because you have to have that integration with the device. It's called osteointegration. So whatever they repair in your body that's related to bone, you want that bone to integrate with the implant, and titanium is an excellent material. But titanium is not the only material. There's a variety of different stainlesses and cobalt alloys that are also used. In terms of applications, and this is big, and it continues to grow because of demographics. And if you think of the baby boomers, so there's a lot of boomers right now, and I'm at the tail end of the boomers. Okay. So my age group is just kind of moving into that category, but there's a lot of people right now, those baby boomers that are in their late 60s and 70s and perhaps beyond. But when you get into that category, that demographic, our bodies were not really designed to last 100 years. So things start to break down. You get into arthritic events and degenerative diseases, and so people have to have their joints replaced over time. Okay, and that's a pretty common procedure. I think, most of us at our age, we know someone, our family or friend that has had a joint replaced. So joint replacement is a big segment, whether it's hips, knees. There's been advancements with ankle and shoulder, although not as prevalent. Hips and knees are probably, the big areas for joints. But then another category, Lou, would be fracture fixation. So people that get involved in sports, people that are active, people that live in, the colder sections of the United States that, have to deal with winter conditions. You get involved in, maybe car accidents, you slip on a sidewalk, you have a skiing accident, you break a bone. Sometimes those bones can be set, but many times they have to perform a surgery to kind of fix that area. And that's where you get into implants that, would involve plates that they would use, and those plates have to be fastened to the bone. Okay. So you got plates and screws for fracture fixation. And then another category would be spine. So as part of that aging and degenerative process, you're going to have your discs, are going to become aged and compressed, and you can have arthritis in your spine. Yeah. But what happens is, you'll reach a discomfort level where you want to get that corrected. So they'll go in and they can fuse vertebrae, and they would use specialty metals like titanium and other alloy systems. They have artificial discs now that they can implant. Okay. I didn't know that. Yeah. So, but there's a lot of technology, and many times what happens, the body is amazing, because when it senses something isn't right, your body will try to overcompensate, right? And I'll use the spine as an example. So, your spine is vertically integrated, okay? But as your discs begin to break down, those vertebrae can kind of get a little bit uneven, okay? So your body's going to sense that, and it's going to try to compensate at some point further up in the spine. And through that compensation, that natural compensation, sometimes you can get a condition which is called like scoliosis. So as your discs get out of alignment because your vertebrae get out of alignment because your discs are breaking down, you're going to start to see some maybe curvature of the spine that occurs. Yep. But depending on how severe that is, they can go in and correct that. And they'll typically do that with devices that include rods, and they would put like brackets along your vertebrae up your spine, and then they would connect those brackets with those rods. And over time they would make adjustments, and that would eventually, correct that condition. So,
and all this is made out of titanium, or?
It's typically made out of titanium, or many times the rods, because they need certain mechanical properties, might be made out of cobalt chrome alloys. But to your point, Lou, these are somewhat exotic alloys. They're highly engineered, and they're made with a lot of biocompatible elements, and it's expensive stuff, relative to like a carbon steel.
Is it also so you talk about the exoticness, but also the fact that it's got to go into the human body?
Yes.
These kinds of products, stainless, cobalt, etc. I assume there has to be, I'm thinking like in the carbon industry, right? We have ISO and QS.
Yeah.
Certifications. Is there a whole separate group of certifications for this too, because it asks it's going to go into the body?
So the FDA got involved, and they worked with the ASTM, and they defined a whole classification of specifications that are tied into the medical industry. So a lot of these alloy systems will have like an ASTM spec that is an FDA medical approved specification. That spec is approved for medical applications. And then, many times, the OEMs or the primes that make these devices, they're going to have their whole quality system and their approved supplier lists. And that's evolved over a number of years. Back in the old days, you used to make devices and, you would channel those into the marketplace. But today, over time, based on enhancements in quality, based on industry events, not all positive, the industry has really tightened down controls in terms of, approvals and quality systems and, change control. So everything is really dialed in today, I would say. It's all very positive. I mean, it's to protect people and companies, and so it's all good stuff. But to answer your question, the FDA is acutely aware of what goes on in specialty metals, and when there's a major quality issue, they pay attention to that, because there have been some significant lawsuits against device companies where systems have failed. Because if you think about these applications, they are critical in nature. You've got human life involved. So so it's all tied together.
I don't know about anybody else. I just learned more about medical devices than I've ever known. And I asked some of that because I've actually had some of that myself. I had an accident with my knee, and the knee shattered. And so they had to replace, rather than replace the bone, they fixed it with metal. I've never known what metal they put in, but there was a lot of metal that they created, and I'm assuming it worked because my knee's back healthy again. But I learned a lot listening to you. It was fascinating.
So when I got into the medical side of the business, I mean, it was like, first of all, I couldn't imagine, because the volume was quite high, and I couldn't imagine all these procedures. I have a much better perspective now that I'm, in my early 60s. But I have a much better perspective because I know how my body feels, right? So in terms of how my joints feel. Now, I've not had these procedures, but the thing is, when I was younger in my career, it was like, you didn't have a full appreciation for what was going on with the technology, but you knew that technology existed. And I think that, most people, you really don't want to go through a procedure, but you're extremely delighted that the technology exists if you need a procedure, Amen. So,
because I needed it.
Yeah. So like in your case, I mean, if you think about it, if they wouldn't have had that technology to help you, what would your outcome have been? You may have been relegated to a wheelchair perhaps, or you would be using some assistance to navigate, to get around. So,
yes.
The technology today really does improve quality of life for people, and it's pretty amazing. And I have to be honest with you, I talked to a buddy of mine that is a little bit older than me, but he called me up. He said, "Hey, I'm having a lot of problems with my hip. Went to see an orthopedic guy. He said, I'm a candidate for a hip replacement. I'm a little nervous. I don't know what to expect." And, so I talked to him a little bit about that, and I tried to kind of ease the concerns. But he shared with me that, like, his orthopedic guy does 8 hip replacements per day. And to me, that was just fascinating. He said, it takes me about 35 minutes to do a hip replacement. Now, if you think about this, I mean, they're going in and they have to open you up. Mm-hmm. They have to cut away the portion of the bone to accommodate the implant, and as well as take away the arthritis, the arthritic portion, the disease portion. Mm-hmm. And then they have to get everything fastened. They have to get it, positioned properly, with all the accurate degrees that are involved, and then they have to put you back together and it takes him 35 minutes, which to me was fascinating. But it also is testimony to the technology that exists today. There's so much precision, and like just the instrumentation involved to do a procedure has evolved to the point where, you know, the goal is to make it easier for the surgeon and ultimately improve the patient outcome. Not only the recovery, but the long-term clinical outcome. And but to me, you know, and it also is a testimony to how big a business it is, you know, for an orthopedic surgeon to be able to do 8 of these a day, you know, and I don't know how many days a week the surgeon does that, but it gives you a feel for, you know, there's got to be some pretty strong demand to kind of stay on that regimen.
Well, and that's where guys like you come in, I'm hoping, Vested Metals, right? Because that product needs to be out there, needs to be produced to code and to spec.
Absolutely. And you know, that's, you know, we're a little bit different than the company that I came from, because we're not a manufacturer. We're a distributor. And, you know, we view ourselves as a solution provider. And I know that's kind of a buzzword. Everyone says, well, we're a solution provider.
Right.
But we, you know, it depends on how you define solution, but the folks that we deal with are either the OEMs, you know, for medical, or the folks that participate in the OEM supply chain.
Okay. And
you know, so raw material is pretty much the starting point for them. But if you think about it, in that business, and you can make a case for any business, but if you don't have raw material to start your process, that's a big deal, right? So,
yeah.
and in today's environment, you know, because mills are very constrained, okay, you've got a lot of other markets that are really kind of pulling resources away from those mills in terms of capacity and different materials. So that's where our role comes into play, because, you know, a lot of these companies have professional procurement groups, and that's all they focus on is supporting the manufacturing operations and the sales forecast, right?
Okay.
So their whole world revolves around making sure that they have continuity of supply.
Right.
And that's really where we come in, because we take that risk out of the equation for them. You know, some of them deal directly with the mills, but as I said, in this environment, the mills are overtaxed. So on-time delivery performance starts to waver.
Yep.
And when that happens, you have gaps in your supply. You know, material's not coming in when it's supposed to.
Right.
And then the other side of it is, you know, stuff happens, right? You have a forecast,
right,
but it's only a forecast. Forecast change. All of a sudden, you have a hospital or a healthcare system that says, hey, we're going to start using this different device system, so we're going to give you an order that is 200 or 300% what we had on the books with you, and we need it yesterday, right?
Of course.
So then these companies, of course, you know, everyone wants to say yes to an order, right? So then everyone starts to scramble. Hey, we have to figure out a way to make this happen. So that's our role in the supply chain is enhanced in those situations, because that's what we do. We go out, we either use our inventories to help companies through those situations, or we will go out and we will source material, you know, for that company. Because Vested Metals, we have a core of maybe 15 to 20 suppliers that we use on a regular basis for our inventories, but we have a global network of close to 100 companies that we've dealt with over the years, and they all specialize in something different. So they're all on our approved supplier list, and we go to them for special requirements, special needs when the situation arises.
What I read in the newsletter, AI.
Yes.
I'm curious how. So not as much in the medical industry, because that seems to be out there, but I'm curious, how is AI, or has AI impacted the way in which you run your business, or the way in which you communicate with customers or prospects, whatever? Has it impacted it yet? ChatGPT, I'm thinking AI, those kinds of buzzwords as well. But How has that had an impact on you?
Well, I think it's impacted us in a way that we know that this is really amazing, critical technology that is evolving. And I think we all agree that it is going to play a role in our business, but we're not quite certain how yet, because I think this technology is new, and I think everyone is trying to figure it out. I think even the companies that are right in the midst of developing AI, I think that they're not even sure where this is going to lead or what the capability will be. So in terms of like medical device and then like our role in medical device as a supplier, I think that AI is going to help with the analysis and the decision-making process for a lot of companies. I think ultimately AI would also help guide the human professionals in maybe the operating room, where it's like the technology, like today we use a lot of robotic equipment in procedures, but I think AI would take that to the next level, where the robot would actually begin to, start to measure and process and then, communicate maybe to the human professional or the surgeon and provide different options, within that 35-minute procedure, during a hip replacement, for example. I think, in our business, I think AI someday, it could help us with a customer interface, potentially. It could help us internally, just help us run our business in terms of analytics. I think the artificial intelligence could, maybe play a big role in planning or order fulfillment in our business. But again, I don't have a clear line of sight as to what that looks like, Lou. And I think, most of the people I talk to, they don't have a clear line of sight either. So it really, it's out there. I think everyone's convinced that it's going to play a major role, but to what extent, I don't think we're certain, but it's certainly something that we all have to stay on top of.
Fair enough. Let me ask you about, let's call it the younger generation. And I don't know if I'm calling that Generation Z or even the millennials or people coming up, et cetera, but just about everybody that I've talked to on the podcast, and indeed people that I speak to in the market, that seems to be kind of the $1 million question. How do we get people interested at the sort of younger generation out of college into our industry? Because everybody seems to have this vision that, it's metals, regardless of what kind of metals.
Yeah.
And, I don't want to do it. I want to go be Zuckerberg.
Yeah.
I'm wondering how you've dealt with that. What have you seen so far?
Yeah. So I guess a couple of comments there. I guess first I would say that the kids coming out of school today are amazing. I think just education in general has just kind of taken, utilizing all the resources available, as the internet evolved over time, the way kids learn today, personal computers, like when I went to college, we didn't have PCs. We had a computer class, but our computer class was, we had to learn how to write DOS. Okay. And then when we wanted to use a computer, we had to use the language that we learned to kind of type up a deck of cards, computer cards, that we would load into a computer. And back then, I remember this, it's etched in my brain, a Sperry Univac 9200, we'd load the deck of cards into the computer, and then it would use the cards to run the program that we wrote. So that's all ancient history. And so I think the way kids learn today is it's just amazing. And the kids coming out today are just so educated and so talented. And we have a very young staff. We have 25 people in our company. I'm the veteran by far. Our president's 37 years old. and then our customer service team and a lot of guys in our manufacturing group are all between 20 and 35 years old. So it's a really, really young company. So to your question, how do you attract them into our industry? And I think, by trying, for us as a company, we try to embrace technology. And I think, the kids coming out today, I mean, they get it because they grew up with technology. There's not a kid going to college today that doesn't have an iPhone. It's not totally integrated in, to the how to use the internet. All of them have done some type of remote-based learning. So we try to embrace technology in our company, but what we try to do is we speak not only in terms of the materials that we're distributing, but we talk a lot about the applications. And I think that's what really fascinates a lot of people, because in specialty metals and the titanium that we sell, you think about aerospace, you think about you think about medical, and you think about the products that the materials go into and how those products affect people's lives. And that's really because in this job, you're dealing with, all those companies that make those amazing products, whether it's a fighter jet, a helicopter, a joint replacement, or something else. It could be a consumer item like jewelry or cutlery or golf clubs or whatever.
Right.
But those applications are of interest to younger people. They really are intrigued by those applications, and we play a major role in the supply chain. So we communicate with a lot of different levels in those organizations, and I think the young folks, that's how they kind of get drawn in. But once we get them in and they start to do their job, it really comes down to, regardless of the market or the industry, it really comes down to, hey, we got a problem out there and we need to solve it. And I think, the young kids really embrace that, because they like to sit down, and they like, many of the kids, and certainly kids that we hire, they like to just try to work with people. You're working with people to figure out a solution to something. And I think once we get them in, and once they engage, that's how we keep them interested. But I have to be honest with you, it's a challenge for a young company like ours, Lew, because part of our core foundation is people are forever, right? So we're very sensitive to, when we hire someone, we're not just bringing in a body to do a task. We think in terms of, we'd like for this person to have a career with our company. And we're a small company, and we're growing and we're evolving. But when you have a young staff, and especially, a capable, intelligent staff, they're going to want to do other things. So the onus is on us to provide them with opportunity. So, that's really our challenge. We're ecstatic about the talent level that we've been able to bring in, but, I can't kid myself. We do feel the pressure to make sure that we have defined career paths for, all of this young talent. And we're going to do everything in our power to retain these kids and provide a career opportunity for them, within Vested Metals. But does that answer your question?
Absolutely. It's been I think it's been an issue for as long as I've, been in my business, 20 years. It's kind of how do you get that sort of younger generation to not look at us as this sort of, icky warehouse? You're right, versus look at all the cool stuff you can actually do in the industry. Yeah. And your business is I think even more fascinating, frankly, than most I've listened to it, because it really does have a direct personal impact on me and my mother and everything else, because you may actually use this stuff like personally. And I find that fascinating. Yeah.
And I'll be honest with you, we really, we can talk about it. They can, they can hear about it from our customers or, our supply chain partners. But what we try to do is we have very frequent lunch and learns, where we will bring in, professionals from different industries to kind of talk about, their products or, their services that are related somehow to the products that we sell. And I think it really helps hit home for a lot of our employees, because they can hear firsthand from, an orthopedic surgeon or someone high up in the military that, has to lead a branch of the services, and it involves, Sikorsky helicopters or certain missile systems. They talk about that, and, these are the applications, and it's critically important that we have, people like us that can support the supply chains, for the government, for example, for the medical device companies, for the aerospace manufacturers, that make the airplanes that we all fly on, on a regular basis to take us from point A to point B
safely.
Yeah. So, there's, and I think, once, our employees understand, wow, what really goes into it, what's behind that. And I'm playing a role, I think that's pretty cool to them.
All right. So first of all, this has been an absolutely fascinating interview discussion, and I'm learning a hell of a lot. I hope people who watch this are learning as well. I have to ask you one more question, and I hope you're okay with it. So I did get on your website and I looked. You have a ping pong tournament? I know it's off the wall, but I thought I've never heard of that before. That's kind of cool because I like ping pong. I want to ask you about that.
Yeah. So Vested Metals, we try to give back to the community, and we host an annual golf outing, and we encourage our employees to go out and give back in some manner. We're affiliated with a lot of the local boys and girls clubs in the community. But in St. Augustine, and I forget the specific cause, but there was a ping pong tournament that was for a very notable cause that we wanted to support. So we participated, okay? But in our office, we, in the front office in the sales area, we have a ping pong table that our employees are free to use really, whenever, time permits.
Right.
And the atmosphere, we're trying to kind of have the type of atmosphere where, our folks can really focus on their jobs, but they also need some downtime, periodically to just kind of, release all the tension, the pressures, whatever. Yeah. So, and what I learned, and I'm not a very good ping pong player, I guess I'm okay, but I'm not nearly as good as our young sales staff. I mean, they are really, really good at it. So you could come into our office and you'll hear that ping pong going, back and forth at a pretty high rate. But it's part of the environment that we wanted to create for the employees. Everyone works hard, they're highly productive, but we try to give them some different options for some downtime while they're still at work. So yeah, we do that. So we have some internal ping pong tournaments, and a lot of our folks that work back out in the warehouse and in production. When they finish their shift, they might come in and they get involved, and some of our sales folks, they'll stay till after hours and just play ping pong for an extra 45 minutes or an hour. So it's been a lot of fun. It's been a nice release for our employees.
I actually love that. I grew up in the industry too, and it was always kind of a show up early, stay late, make 1,000 phone calls, don't get off, don't get up to do anything but talk. And I love hearing this sort of new. I mean, that's a hell of a way to bring in, the younger talent by telling them, yes, we're going to work hard, but we're also going to play hard. And what you're describing almost to me just sounds like, not quite Facebook, but like all those stories you hear about the way those companies operate. And it's cool that a company like, from our industry can actually do that. And I think that's unique. I think it's awesome. Yeah.
I mean, at the end of the day, as long as we are, taking care of our customers' requests. We're doing it in an acceptable, timely manner. We want it to be fun. We want it to be a fun environment. We celebrate quite frequently at Vested. Every single, birthday party is celebrated at lunchtime with a birthday cake, and we get all of our employees to participate. Even our remote employees are calling in for every birthday party. So, we want it to be a fun environment. We appreciate people. People are forever. And really, that's a very heavy focus for us.
I think that's pretty cool. I think it's a great place to sort of end the interview at this point, because this is people, like I said, people really do, who are listening, go check out their website. It's a cool website. It's also got a really great newsletter, but what an interesting and unique business that I really did not know all of the stuff. And I really didn't know where, like I said, some of the parts that went into, my surgeries actually came from. And thank you for taking the time and sharing with us and with me, because I learned a lot. So thank you, sir.
Oh, thank you. I really enjoyed the conversation, Lew.
I appreciate it. I'm going to do my little outro here, and then I'm going to hit stop record for all those people watching. So here's how this works. Anyway, this is Lew Dennen. Thank you for watching EOXS Stories on Steel and our interview today with Tom Zuccarini from Vested Metals International. And if you're interested at all in being on the podcast, leave me a message, send me an email, let me know, and I'll be happy to host you. Until next time.